Okay, the 91st most common post-COVID-19 symptom is recorded as thrush. Now, again, this is fairly specific. Thrush is a fungal infection caused by a yeast, usually Candida albicans, and so usually that would have been made by a diagnosis by a medical professional, possibly with a culture, and then usually requiring antifungal agents as a treatment. So anyway, approximately 5% or less of people surveyed post-COVID-19 had this sign or symptom or actual diagnosis in this case. Now what I would point out is thrush would be a secondary fungal infection after the COVID-19, not a primary infection of COVID-19, but probably caused by disruption of the immune system allowing the fungus to grow. So thrush is a fungus, a yeast actually in the oral cavity, usually, but can spread if it gets worse. Causes white plaques or patches, pain, trouble swallowing, possibly hoarseness of voice, and general malaise, not feeling well, etc. So anyway, if you do have thrush, this requires treatment and also investigation to why and how bad your immune system is after you've had post-COVID-19. Okay, the next one is number 92, was recorded as personality changes. So usually a patient will have a family member report personality changes because often the person having the changes doesn't realize that they're having the changes. Now again, this could be a serious symptom of a central nervous system involvement by the virus, such as an encephalopathy or an encephalitis, that is inflammation or infection of the brain caused by the SARS-CoV-2 virus, which is known to occur and is actually one of the most common symptoms. So this is a minor symptom, less than 5% complained by post-COVID-19 patients. Again, if this is happening, especially if associated with other neurological or other symptoms, please have it evaluated urgently, as this could be progressive and could indicate more serious problems. Okay, the next one, number 93, is GERD. That is GERD, gastroesophageal reflux disease. And again, this is a very common sign and symptom and diagnosis in normal medicine, but post-COVID-19, apparently this was a new sign and symptom and diagnosis, and again in the low minority of less than 5% of all cases based on this survey of post-COVID-19 symptoms. So anyway, if you have signs and symptoms of GERD, you should get it evaluated. There's medication for it, indicates abnormalities are happening. It could even be a cardiac problem happening. There are complications of GERD if it happens for too long and excessive amounts. It can even lead to carcinoma. So please get it evaluated and treated if required. And again, this is more a diagnosis than sign or symptoms when the diagnosis is given. Okay, again, the signs And symptoms that probably should have been given, as this is a symptom study, are chest burning, chest pain, feeling of stomach contents coming up into the back of the throat, sore throat, waking up at night with a sore throat and cough, clearing of the throat, and other symptoms such as that are the actual symptoms and signs of GERD, gastroesophageal reflux disease. Okay, the next one, number 94, is herpes. Now again, this is probably more a diagnosis than just a symptom, but I guess everyone knows what herpes is, like at least herpes simplex, type 1, which causes the cold sores that people see, so I have to assume that's what they're talking about, rather than herpes 2, the genital herpes, but who knows. The symptom is just herpes. Now, usually to be that specific, one would have had to culture it and make a diagnosis by a physician, but I will assume they're just speaking of the symptoms of a cold sore rather than having the actual diagnosis and culturing of the herpes, supposedly simplex virus, and I assume type 1 in this case. But again, as a complication of post-COVID-19 symptoms, the virus can suppress the immune system and lead to secondary infections developing, such as other viruses, such as the herpes type 1 virus. Now usually the herpes type 1 virus is dormant in the body, and a suppression of the immune system causes an exacerbation of the signs and symptoms, in this case cold sores. So that is probably what has happened in this case. Anyway, usually these people know what the diagnosis is. They usually have medication for it. New onset herpes can be or should be evaluated and treated, often with antiviral agents. Okay, the next one is number 95, which is anemia. And again, this is more a diagnosis than a symptom. The patients must have seen their physicians and had a blood count and been diagnosed with anemia, which means a low hemoglobin level in their blood, which means usually low red blood cells and the ability to carry oxygen to their tissues. So again, anemia has a side effect of, or complication or symptom of post-COVID-19 is a little bit unusual, I think, but could happen. The symptoms obviously would be weakness, dizziness, syncope, dizziness or passing out when you stand up, and possibly shortness of breath, lack of energy, increased need for sleep, etc. Those would be the symptoms of anemia. But for some reason in this survey, the symptom was called anemia. And so anyway, it was less than 5%. So we can contemplate that some more later. Okay, the next one, number 96, was elevated thyroid. Now this is interesting. This is another diagnosis. Elevated thyroid usually requires a thyroid test, or at least a physical examination showing the signs and symptoms of hyperthyroidism. So again, this is a low number. Low number of respondents. I'm not exactly sure what this means. Viral infections can cause changes in the thyroid. Hyperthyroidism or elevated thyroid can be due to inflammation, can be after a viral infection. Hyperthyroidism should be taken very seriously, should have an evaluation and treatment, and also to determine what the cause is and if it is absolutely from the SARS-CoV-2 virus, which there have been cases, but most cases are not related to SARS-CoV-2 or COVID-19 infections. So anyway, if you have that diagnosis, please have a complete evaluation and treatment. Remember the first George Bush president passed out when he was in Japan, and it was because he had hyperthyroidism, Graves' disease, it was called. So this can be very serious and can affect many people, including a past president. Okay, the next number 97, is throbbing neck. Sorry, a big huge mosquito. Throbbing neck. Okay, what's this mean? Throbbing in the neck is a pulsation in the neck, I would assume. So associated with maybe pain, so neck pain. Throbbing, usually if it's on the synchronicity with the heart, would be associated with blood flow. So possibly with the inflammation and possibly the thyroid, I would think. So anyway, a throbbing neck, I would think you would have to have it evaluated just to see what's going on. Kind of an unusual symptom, low on the percentage of reported symptoms for post-COVID-19 symptoms, but again, could be significant. Something's going on which is not really obvious at the time, just from 2 words. Okay. All right. And I get now to the last one is syncope. Syncope, this means passing out or getting lightheaded, such as when standing up is a common symptom, but the usual result is either decreased level of consciousness or loss of consciousness, which would be called passing out. This is a serious sign and symptom. It was the lowest on our list, but one of the most serious and should be checked out. If someone passes out, probably wise to call 911 and get them checked out, especially if they're having other signs or symptoms. They may need a thorough evaluation and thorough treatment. Okay, that ends our signs and symptoms of COVID-19. I'm here on the bank of the Gold Creek in the Golden Ears Park, part of Garibaldi Park, which is a major federal guarded national park in the Canadian government system. So I hope you enjoyed the video. If you did, please subscribe to further ones. This is number 4 in the series of 4 on post-COVID-19 symptoms, the most common 100. We have done 100. The first 50 were in lecture format as a slide presentation with photographs. and discussion and captions. These were less significant, I thought, the last 50, and less specific, and less directly related to post-COVID-19 symptoms, so that's why I'm doing them by verbal format in this nice place, beautiful, nice place here. I hope you enjoyed the babbling creek behind me, and I hope it didn't drown everything out. We will continue with other lectures, other formats, other videos on YouTube. Please subscribe, please comment, please forward to your friends, and please thumbs up. I would appreciate that, so I will keep doing more of these if I know they're appreciated. Okay, thank you very much. Gary Ordog, MD, signing off on the 100 most common post-COVID-19 symptoms. Stay safe, get your vaccination, and be healthy, be good. Thank you.